Hello, everyone. I'm Tanya Rivero. Thank you for joining us. The CDC says fully vaccinated teachers, students, and staff do not need to wear masks inside schools. That updated guidance comes after Pfizer announced plans to seek emergency approval for a COVID booster shot. Right now, that booster is undergoing trials. Pfizer says the initial 2 doses of its vaccine still produces a strong immune response against the Delta variant, but a third would make that response even better. The CDC and FDA are pushing back, though, saying fully vaccinated people, quote, do not need a booster shot at this time. The Delta variant is the dominant strain in the U.S. and is surging in several states. Pfizer also says it's developing an updated vaccine to target the Delta variant directly. Dr. William Schaffner joins me now. He's the medical director of the National Foundation for Infectious Diseases and a professor at Vanderbilt University School of Medicine. Dr. Schaffner, welcome. Great to see you. So let's begin with this updated guidance from the CDC out today. The agency now saying vaccinated teachers and students do not need to wear masks inside schools, which is clearly going to be very welcome news to a lot of people. But what do you make of that? And what are the risks for a teacher or child if they're not vaccinated? Because, of course, we know 12 and under cannot be vaccinated, especially when it's difficult to safely social distance in many schools.
Well, you're exactly right, Tanya, but I do hear the big hurrah out there as everybody heard about these new recommendations, because that will mean opening schools is much easier this fall. Unvaccinated teachers, my goodness, and other adults who are in schools, please, you still have plenty of time to get vaccinated. So let's do that. And then 12 and over, that's the recommendation. Let's get all those children vaccinated also. The fewer unvaccinated children we have in schools, of course, the better it will be. And for those youngsters who are younger than 12, schools will have to continue what they've been doing during this past school year. Masking, social distancing, all of those things, although they're imperfect, they really do, if you do them all together, offer a really great assurance of low risk in school systems. And if all the adults in the community get vaccinated, that further reduces the risk, of course, in schools itself.
I know my vaccinated children were very happy to hear that news about the fall. Doctor, the Biden administration has already been pushing for people who have stayed on the sidelines to get vaccinated. Now Pfizer, however, is asking for approval for a booster shot and saying that it is tweaking its vaccine to deal directly with the Delta variant. Will this just create confusion over how effective these vaccines currently are? And what do you think about the booster? Do you think it is necessary at this point?
Well, I think it's wonderful that a booster and a Delta-specific vaccine are being worked on. We want them on the shelf if we need them. But I'm in agreement with the CDC and the Food and Drug Administration and the NIH to the effect that at the moment, well-vaccinated people here in the United States do not need a booster. These vaccines are very effective in keeping vaccinated people out of the hospital, and that's excellent. It's the unvaccinated people we have to look at. They haven't even gotten dose 1, never mind dose 3. So let's get those folks recruited so that they become fully vaccinated also.
And Doctor, we know we can't stop talking about it because the highly contagious and deadly Delta variant of the coronavirus is rapidly spreading, not only around the world, but here in the U.S. The CDC reports there are currently 5 states across the U.S. where that strain is now the dominant strain. How dangerous is this as the country looks to move past the pandemic? I mean, by the time fall comes and summer is over, what do you predict we'll be seeing from the Delta variant here in the U.S.?
Well, Tanya, currently we have seemingly 2 Americas, the well-immunized communities and the much less well-immunized communities. And it's in the latter, those communities that are less well vaccinated, where this Delta strain, highly, highly contagious, will continue to spread throughout the summer, into the fall, and into the winter, until we can recruit more and more people into the vaccinated pool. Because the more vaccinated, the more difficulty the virus has in finding another person to whom to spread. So we really need to get our still unvaccinated brothers and sisters over to the vaccination sites.
And Doctor, do you think, though, that this Delta variant will start to make inroads in those areas of the U.S. where we are vaccinated? Because we are seeing something like that happening in Israel. And in some ways, Israel is sort of 6 months ahead of us. Do you think that that could happen here in the more vaccinated areas of the country?
Well, let's make a careful distinction. The Israelis make that distinction. These vaccines continue to keep people out of the hospital. Now, we would have hoped that the vaccines also would have prevented infection. That is, the virus can infect us even though we're vaccinated, and we might be able to transmit the virus. With the vaccine, we're much less able to transmit the virus and become infected, but it's not zero. And that's what the Israelis are showing, that there is this low symptom, asymptomatic transmission that's going on, but people are still being kept out of the hospital. And of course, that was the main goal of the vaccines. And they continue to be successful in doing that.
Well, that is the good news. All right. Well, Dr. William Schaffner, thank you so much for joining us. We appreciate it.
My pleasure.